Hi everyone, it's Dr. Dave and I am coming back to you with a question I get asked all the time in the office. Now, we live in the digital age. Everybody has their smartwatch. They're being super monitored. We know what our heart rate is at all times. We know what our sleep pattern is. So the question I'm asked all the time is, hey, Dr. Dave, what is a normal heart rate? Okay, so that's a tricky question because typically normal heart rate has been defined between 60 and 100 beats per minute. Now, 60 to 100 is a fairly wide range. So what I like to tell people is there is no really normal heart rate for everyone, right? It's very hard to say what's normal for me may be normal for you. But what I would say to people is don't pay so much attention to the heart rate number unless it's really low or fairly high. So what do I mean by that? Well, if your heart rate is less than 60 and you're over 55 years old, you may want to get checked out. If your heart rate is greater than 120 and you're over 70 years old, you may want to get checked out. So it's very tough to say everybody needs to be between 60 and 100. In fact, now the thinking is lower is probably better, and it's probably a reflection of how healthy we are, what our general fitness level is. So there was a recent study that showed that heart rates greater than 76 on average tended to be an indication of a less healthy state. Men with a resting heart rate of 85, probably not a good sign, probably should be lower than that, and is a reflection of our overall fitness level. So what I want you to remember is when you're wearing your Apple Watch or your smartwatch and it tells you your heart rate is particularly low or particularly high, put into the context of a couple things. Number one, how do you feel? Do you feel okay? Number two, how active are you? Are you exercising all the time? I have patients who are very physically fit in my practice who walk around with resting heart rates between 40 and 50 beats per minute, and they're perfectly fine. Now, if you're curious as to how high your heart rate can go, you can try a simple formula, which is 220 minus your age. So if you have a 20-year-old, 220 minus 20 would be 200 beats per minute. That is how fast a typical 20-year-old person's heart can elevate to with, let's say, exercise or if they're really stressed out. And speaking of which, we have to remember, heart rate needs to be taken in the context of our environment. Are you stressed out? Are you sleep deprived? Are you drinking excess alcohol? Are you dehydrated? So heart rate is very sensitive to our environment, our surroundings. So next time you see your heart rate on your smartwatch or you take your heart rate, don't panic. Take a step back, ask yourself, how am I feeling? And what is my overall status, my health status, my hydration status, my stress level, my sleep? You need to take all these other factors into consideration before we just say your heart rate is normal or abnormal. And of course, always discuss this with your doctor. Now, I just want to talk to you guys about a company that I partnered with and I absolutely love. It's called Save a Life. And they are a company that offers free CPR courses, BCLS, ACLS. And it's something that I really want you all to check out. Just click the link below. Save a life. Remember, heart disease is the #1 killer of men and women in this country. And as I always say, time is heart. The faster we can intervene, the faster we can start CPR, the higher the chance we have of saving somebody's life. Okay, everybody, until next time, this is Dr. Dave.